Welcome everyone to our webinar today. And yeah, I'm Jonas. I'm one of the founders. I'm CEO here at Nilo, which shouldn't be the center of attention today. Center of attention is Maria Angel. And welcome, first of all. We're going to introduce you in a second. But we are really happy to have you here. And today we're going to talk about from intent to impact, how HR and leaders build impactful and measurable mental health strategies. Of course, I need to take that second while everyone is arriving to give like a 20-second intro to Nilo, which is really the last time we're going to do this in this session. But just to give you a quick overview also why we're talking a lot about mental health, this is exactly what we are doing with Nilo. The idea is we give companies easy access, holistic mental health support for their entire workforce. So we stand for three pillars. So like precision care, we really give every employee within the company the right level of support where they are on the mental health spectrum, or if they are in a leadership position or something else. We try to have real impact. So we always measure the impact we're having on the well-being of the person and then the performance of the company. And we really work closely with the companies to make that happen. And here are some of the companies we work with. We work with over 500 companies in Europe by now, a lot of big international corporations. And that's it from my side on the Nilo side. And now the more exciting part. And yeah, I'm handing over to you, Maria Anke. First of all, welcome from our side. Thanks for taking the time. And would be great if you can quickly introduce yourself. Yeah.
Yeah, of course. Thank you for having me. So, hi everyone. My name is Mariangel Maldonado. I am originally from Mexico, very proud Latina, but I've been living in the Netherlands for around 10 years now. My work sits a bit on the intersection between mental health, inclusion, and employee experience. I originally trained as a clinical psychologist, and I work with many different people throughout that time supporting their mental health, from children, adolescents, couples to inmates from prisons, patients at hospitals. And through all of this experience, I saw that mental health is never an isolated component, and it operates in the system, and it operates between our identity, the environment that we're in, and how are those things supporting us or not. So later on, I brought all of this expertise into organizations, and I started working developing health strategies for companies. So that's a bit of what we're going to talk about today.
Amazing. Thank you so much. And let me stop sharing this so that we see you a little bit bigger. Let's jump into the topic right away. What we are seeing these days, I mean, when we look into the news, it's kind of, it feels like, where are you? Here are you. It feels like mental health is basically everywhere. Sick days are going up, burnout is going up, absenteeism is going up. So mental health becomes a bigger issue, and more companies kind of acknowledge that it's becoming a topic and that they want to do something about it, so that there's an intent, so to say. From your experience, where does the gap mostly come from? From this intentions, I want to do something, and then the really having an impact and starting doing something.
Yeah. I think, first of all, I want to say that I truly love the fact that mental health is front and center in the way we talk about employee experience and work now. When I started, that was not the case. And now to see the fact that, okay, like this is something that people are talking about and are talking about more openly. This is also something that the new generations have as an expectation from their employer around, hey, how are you going to be supporting my health and well-being? So all of that part is something very positive. And I think when the good intentions failed is when we don't recognize that it cannot be a standalone initiative and it cannot be a tick the box exercise. You cannot say, oh, but we have an EAP, an employee assistance program provider, or a well-being app, or we do this mental health date once in the year and that's it, right? Like we've done something. It actually needs to be embedded in the culture of the organization and the systems that people operate in the organization. And I think the most important thing is to recognize, is the environment creating within that company supporting the mental health of individuals, but also supporting them to access the resources that are available for to them, right? And this is thinking about, does psychological safety exist? Are workloads manageable for people? And are leaders supporting this with having the right conversations and the right dialogue when they talk about, performance and meeting the targets? I think when you look at the big picture, that those are the things that one should be considering to know if what you're putting in front of people is going to have an impact. And if you notice more that you have like a standalone initiative, you need to be thinking more about an ecosystem of support. So different people are going to be at different stages when it comes down to their health and well-being journey with their mental health as well. So you need to be making sure that there are things that are going to resonate with them depending on where they are on their journey. Some people are going to need education and awareness and having a common language around this topic. Other people are going to be maybe struggling or in crisis and they're going to be dedicated support. And other people are going to be just curious about it and they maybe need more like an understanding that at some point, if they need anything, they know where things are for them when they need them.
Got it. So it's more, you're also saying the biggest intention why people are not moving, the biggest gap, sorry, why people are not using from intention to actually doing is that from a mindset perspective, people don't see it as a holistic thing, that it also includes culture and it includes awareness, communication, and it's not only, hey, there's this one initiative we do, and then we check the box that mental health is basically done.
Yeah,
Yeah,
exactly. It's
cool.
about that visibility
Hmm.
and having something, but
Hmm.
also about how does it integrate with the culture and the ways of working.
Okay, understood. And now, if we want to go one step further and say, okay, we want to start implementing something. Okay, we have this intention. Like, where should we start? I mean, you now mentioned a few things, like where this gap is. So probably it makes sense to fill that gap. Or like, how would you advise if I'm a yeah, HR leader, I'm thinking about, I think mental health needs to be core and center more in our organization. Where would you advise me to start this? Yeah.
I think, first of all, with listening to people. Okay, how are people experiencing the workplace? How are they experiencing their workload? How are they experiencing their performance management, the cultural feedback that may exist or not? That sense of belonging that they get in the company, can they show up as their true selves within and whatever they decide to share? Because sometimes I feel like people go into these extremes of, you need to show everything about yourself at work. And it's like, no, whatever I feel comfortable sharing and knowing that I can do that and that's going to be respected and I'm going to be welcome and appreciated. That part is really important. And then looking at the data that you do have available. So think about, okay, that sense of belonging, that work-life balance, that employee experience, and then you go and look at absenteeism, productivity, your sickness rates, and all of that to then understand what are some of the common threads around these things. What are the insights that you can get from it so that you understand where are your root causes? A lot of the times, this is also something that we fail. We just want to jump into solving things where it's like, are we truly understanding where is this coming from? And then once you have listened to people, once you have seen the data and the numbers, then you can think about how do we integrate this in a way that is going to resonate with others? And then how are we going to make sure that this is part of the whole employee life cycle, right? From onboarding to an exit interview. What are those key moments where we're talking about the topic of mental health, we're offering support, we're reminding people of that support available, and we're allowing to create that space for people to access this? I think another thing is when we talk about mental health, we fail to recognize that even though the conversation is more open now, we're still in multicultural environments and people can relate to mental health from many different angles. So there's still a lot of stigma that can exist on this. So you also need to be thinking about talking more about holistic well-being and mental health being an element of that. I think in my previous experience, that was something that worked really well when we talk more about, okay, there's well-being, mental health is an element, but you also have physical health, emotional health, social health, financial health, and all of it is interrelated and can ultimately impact mental health, right? So you need to be thinking about how are you introducing this in a way that will resonate with people after you did your homework with the root causes and the data, and then go into the solving mode, right? Like not just jump into solutions.
Hmm. Can we go a little bit deeper into this collecting the data? Like, how would you, is it really you do like pulse service you would send out to the entire company? Would you like, did you do interviews with specific people? And how would you like really try to understand what are some of, like look against some of the data like sick days and so makes sense and most of the companies have it, but to understand really what root causes are, like what are really themes people are struggling with, I could imagine is a little bit more complicated. Yeah.
Yeah, and I don't think there's anyone out there that has gotten this right entirely. I think we're all learning and growing and figuring this out. But if you go and look at the research around employee well-being and well-being in the workplace, there are some common themes around this, right? Like you know that mental health has a correlation with productivity, with absenteeism, with that sense of belonging, with the perception of support. So those are things that you can be measuring in your employee engagement survey when you're thinking about, okay, do people feel that there's psychological safety in the environment? Do people feel like they can have open and honest conversations about this topic with their manager, but also that their managers feel equipped to support people? And then you can be looking also at what is the work-life balance in that culture that you're creating as well. I think if you were to break it down into three different elements, you need to be thinking about what are some of the experience indicators? How are people experiencing the workplace? Then you need to be thinking about the behavior indicators, because that's a lot of also the time where people focus just on that, which is like, okay, are people using the tools and resources available? We think about employee well-being just in terms of engagement. Are people attending the well-being events? But it's actually one element of it. You have the experience, you have that behavior around utilization of benefits, attending events, how is leadership engaged or not on this? And then on top of that, you have the organizational part, right? Where you can look at the other metrics around absenteeism, retention, employee engagement scores per se. And within that, I think the best thing that you can do is have a dedicated team of people analytics. Go with a research mindset into this, with your hypothesis, with your questions, so that you can look at everything from a systems perspective. And then you can find, okay, what are some things that are connected, right? I think in our experience, we realize like, yes, it's great to have your sort of like one size fits all program and strategy and approach, because you need to have that just like as a safety net, let's say. But then if you look deeper, are they specific groups or populations within your organization that are struggling more? Or are there moments in that employee life cycle where people need a bit of additional support, where you can see spikes maybe on absenteeism or sickness rates or lower engagement, or I don't know, like perception of manager support, and then deeper into what is happening there. Because sometimes we can see that that is for more vulnerable populations, like people returning from parental leave, or people that have already a pre-existing condition that then go into the workplace and it doesn't work for them, because not all places work for everyone. And we also need to be thinking about how are we adapting our workplace so it works best for most people, more people, and not just the majority, right? But are we actually making the workplace more open to people that have different needs, right? When you think about accommodations and minorities and also bringing in that perspective for those that need it, right?
Hmm. Makes a lot of sense. And I guess just one comment also from our side, we always also, when people, employees use Nilo, we also always measure the well-being of the people and how that kind of develops over time. And for example, one theme which came up the last couple of months a lot is when companies go a lot through restructuring, change, then we see more and more people basically with more acute symptoms. And this is also very interesting, which then pops up for the company seeing like, hey, it's a very tough time. And we also see this in the data. We have more people struggling. So it makes sense to have more focus on this and also support the people more during those, yeah, more uncertain, more intense times, so to say.
Yeah, and I think that's very important when you have a well-being strategy that you think like as a company you think about prevention, right? And think about, are there moments or things that are coming our way where we're going to need to have additional support for people, and also that you are flexible to be reactive to world events, right? Like the world we live in, the constant thing is change. Things are happening. So how are you responding to that to best support people? Because the things that happen outside are going to have an impact inside. It's not like you can turn off the news or what's happening and then just focus on your work, right? Like you bring some of that into the workplace as well. And to me, beyond the data and all of these things, another really good measure of success, it's exactly this. When an employee says, I feel comfortable talking about this in this place, right? Like if they feel like they can openly have conversations around what's in their minds or what is happening or how the environment is affecting them, then that's already a measure of success, right? Because you're creating the right culture around this topic.
Can we talk a little bit about this? So, because it's also, I mean, what we see over and over again is when you have a culture which is more open, supports this more, people talk about this more, then also a service like Nilo is used in a good way. Then you have other companies where there's a high stigma around it and people feel uncertain to even use a service because they have some fear, hey, maybe the employer is tracking this somehow, maybe I cannot talk to my manager about it whatsoever. So, um, how would you like concretely initiatives, ideas, how you kind of, yeah, create an atmosphere where people openly can talk about those issues, where we, yeah, push the stigma away?
Yeah. Well, I think that's also a question that I would like to uh, put out there. And I mean, if people feel comfortable sharing in the chat, they can. But if not, it's just like have a little moment to reflect for yourself. At this moment in time, wherever you are working, do you feel like you could have an open conversation with your manager if you were struggling with your mental health? And I think it's very important for us to think about like at this moment, do I feel like I could be doing that? And if not, what will be preventing me from that? Because at the end of the day, that this is something very true that access or having resources available does not equal trust. Trust is something that you intentionally need to build to reduce some of the stigma. And a couple of the things that you can do in that place is first create that awareness and having those open conversations and educational moments for people, and also make it relatable and practical. We did a really good educational campaign on this where we will deep dive into a topic that was related to mental health and well-being. We talk about the science behind that, and then we will give people practical tools around how can you improve this. And we will have two options. This is how you can improve it individually, and this is how you can look at this as a team, right? So if managers will wanted to bring this topic into their team meeting, they could do it in a very practical way. And then at the end, we had links to all the resources available, right? Like if this is bringing up things for people, here's where you can go for additional support. So I think normalizing that conversation, making things accessible, making them digestible and simple to understand matters a lot. And another thing that it's very important is that leadership engagement, making sure that the message is also coming from leaders that these are conversations that we can have here. And we saw the biggest levels of engagement when we have leaders sharing their own lived experience. We all have mental health. We all struggle at certain times. Yes, there's people that have pre-existing conditions, but there's also just the reality of like we can all have moments where we're struggling with this. So once we have our managers opening up about how do they manage their own mental health, how do they stay fit mentally, what do they do when they're having a bad moment, how do they even access the support available, that made a huge difference for people. And another practical thing is having communities of ambassadors, champions, mental health first aiders, whatever resonates with your environment and organization, because you never know when people are going to need to have that conversation, that opening up. And if you have people spread across the organization that are trained for this, that can signpost to available resources, that know how to have the conversation in the best way, then that helps create that environment of trust and openness, right? And very importantly, manager capabilities. A lot of the times, this is how we started, right? Like, do you feel like you can have a conversation with your manager right now? A lot of the times, people managers are put in a position where they are the first line of support for people, right? Because it's the person that you interact the most with in the company or where you have more conversations. So it's important to give managers the right tools, the right guidance, the right training, so that they also know how to respond to this in the best way. And it's not a manager's role to prevent things or to solve things or to make things better for people. It is their role to know, okay, how am I creating the positive environment, but also how do I pinpoint people in the right direction for support? And most importantly, create the time and space for people to use these resources. A lot of the time, that's all that we need. We need that permission to know that it's okay to use what's available for us.
100%. Yeah. Can just underline everything what you're saying is also our experience when it just comes to my mind one big retail company there for the onboarding of Nilo. Really, the CEO also was standing there and saying like, "Hey, we introduce this because we believe it's very important. I personally had, a therapy in the past, and this was very helpful for me. So I know the value, etc." And then this makes a huge difference because it's exactly what you're saying. It gives the basically the allowance for everyone to use the service.
Yeah, and I also think it's
Um,
important to have those stories of success and resilience and all of that, right? Like, because I say, like, mental health is a continuum. There are moments where you're going to be great, there are moments where you're going to be struggling, and to have the hope to know that other people struggle and they have come out of it and they have access support and it has made a difference. It also inspires you to do the same when you are the one struggling. And also when you know, like, there is a light at the end of the tunnel. There is another side of my experience when I'm struggling. I think that that also shifts the idea of someone with mental ill health will never recover or will always struggle or is an underperformer when that doesn't need to be the case.
yeah. Um, Times are a little bit more uncertain than usual, I would say, and budgets are tighter than usual. And from your experience, I mean, you have implemented lots of things, some more costly than others, but how is your experience to really best kind of connect the mental health initiatives, the well-being initiatives to business priorities? How do you unlock all the budgets in those companies? What's your take there?
I think the big question, because a lot of the times people ask, like, oh, can we afford to dedicate budget to this? And I will flip that to, can we afford not to? Because mental health and well-being are directly linked to performance, to productivity, to absenteeism, to engagement, to retention, all the things that have been mentioned, right? Like, so if we invest in mental health and well-being, we are allowing people to grow in their resilience, in their ability to be creative, in their ability for solving problems, for that loyalty and level of engagement that they will have towards the company, like all the positive things that you want, right? And a lot of the times people think like, oh, it needs to be this huge investments on solutions and everything. But if we go back to what we're discussing, it starts with the culture and the environment that you're creating. And a leader having an open conversation doesn't cost you a lot of money, right? And then it guides people to the things that are already there. And having those educational moments are also things that you can do in partnership with the employees, right? A lot of the times, the best strategies come from grassroots initiatives because people want to be co-creating the solutions as opposed to just being told this is what's there and what you should be using. And there's also a lot of expertise within the people that have their own lived experience around what is needed to solve some of those root causes as well. So I think I always talk about that co-creation. So yes, as an employer, you need to be having the tools and the resources available and creating that culture that you want. And then as an employee, you have the responsibility to utilize what is available for you and sort of like feedback on what's working and not working. And that loop in itself doesn't need to be too expensive. It just requires the time and the right attention for having those conversations.
Hmm. And if what very often then comes, or what we hear from sometimes C-level, the when HR or the well-being people then come with the, hey, we have this number of absenteeism, hey, maybe we have the qualitative feedback, we want to implement something. And then what's your response when then the feedback is like, yeah, okay, I understand it, but how can we say that implementing mental health tool really will decrease sick days, will decrease absenteeism? What's kind of your, because this is something which really comes up on a day-to-day basis.
Yeah, of course. And I think that's because we're asking the wrong questions, right? Like we are the goal cannot be to reduce sickness rates or absenteeism in itself. Like, I understand that that's also where a lot of people focus on because that's where you can see cost, right? As an employer as well. But there are so many factors impacting well-being, particularly like we're saying, with where the world is right now, that you cannot ultimately say this thing that I implemented reduced this. It's part of a whole system and it's part of a bigger picture around that. So I think flipping that around the other side of the conversation, which is that sense of belonging, that work life balance, the workload management, the things that are going to enable people to have more space to deal with all the other stuff. Those are the things that are going to ultimately drive sustainable performance and resilience and prevent the absenteeism and the sickness rates and all of it. So I think it's more focusing on the part around how do you create sustainable performance as opposed to just absenteeism and sickness rates. And that will vary depending on your environment, your condition,
I
your
like it.
industry, and so on.
I like it a lot. Yeah. Because it's also a more positive thing. Yeah. It's a positive framing. It's like, hey, you wanna, I mean, almost everyone would say yes to, hey, we want to have a kind of healthy, motivated, happy, driven, resilient kind of workforce. I mean, everyone would say like, hey, this is amazing to have, and it kind of flips it on its head from the kind of negative framing on sick days, how to reduce that, etc.
Yeah, and if you look at it
Um,
from like an individual perspective, when we think about well-being and staying healthy and all of that, is the small things made with consistency that create a change, right? If I exercise, if I eat healthy, if I sleep well, and all of that, my mental health is going to be better than if I don't. And if something happens within that, I have a bad day or anything like that, that's not going to impact the overall, right? But also the consistent thing of taking care of myself and the discipline around it and all of that, it's also going to make me more resilient for those bad days or those bad moments, right? So it's the same when you look at the big picture of a company.
100% agree. Um, One comment from my side also, when there are people looking to implement something in their company and want to convince management, is also, I would highly encourage you also to find a sponsor kind of in the management team, because very often this topic is something that a lot of people only understand once they felt something themselves, or they had a good friend or someone in their family who experienced kind of bad mental health in the past, and then they can really relate to it. And finding that person in the leadership, in the management, who then is also on your side supporting you, is very helpful. Yeah.
Yeah, and I think that that's, I mean, the statistics are there, right? Like 1 in 4 people will struggle with their or are struggling with their mental health, like at this moment, right? So like there's because it fluctuates, there's a lot of people within that, and if it's not a personal experience, it's someone close to you as well. So that's important. And what I will say in that is just be mindful of inviting people to be their sponsors that are ready to share their experience as well. Like don't force people into this space, but make sure that they are in a place within their own mental health journey where they can openly talk about it in the best way, because that also resonates best with people and it protects their own health and well-being.
Let's say now we have the budget, we start doing implementing our mental health strategy, and you also mentioned in the beginning, which I liked, you have to think about the entire kind of people experience life cycle from onboarding to offboarding, and where do we need to implement what. Um, how can we measure in the end if it really works, if it does make a difference or not?
I think that's the question that we're all trying to solve. There are different ways where we can look at this, right? Like I was saying, you can think about engagement. Yes, are people utilizing the resources? What is the feedback that you're getting for that? What is like if the resources that you have available allow you to measure sort of like stress or anything like that, are those things changing? That's one of them for sure. The other one is looking at that employee engagement surveys that you have, and what is the feedback that people are providing around your culture, your environment, your manager support. Do people feel valued and appreciated in the company? Do they feel like they have the right resources to operate in their role? All of those things are also important. And then is the part around, yes, how is your productivity, your absenteeism, your retention, and within those conversations, what are people sharing that could be improved, right? Like, are you actually looking at the feedback from your exit interviews, or at the feedback that people are providing after their performance review? Because performance review is a moment of a lot of stress for a lot of people, and it's also where you see fluctuations in your, let's say, health metrics. So going a bit deeper into those moments, and you can say, is this the environment that we want to create, and are we creating that difference because you have all those things in place?
Got it. So it's not just looking at one metric, it's a combination of a lot of things. It's on the one hand side, it's the more quantitative things like absenteeism, etc. What's the utilization of tools you provide? But on the other hand, it's a lot of qualitative feedback as well, so that you
Yeah.
have interviews from the exit interviews from etc. etc.
And I will say even the next level of that will be, like I was saying before, is look at the different groups and populations you have represented within your employee group, to also understand the different experiences, right? Like, are you also creating a better place for women in your organization, for neurodiverse colleagues, for people that have other chronic conditions? Like, also making sure that you're not just going for data of a one size fits all, but you're also going at a level deeper. And if you are creating a more inclusive environment and supporting all these communities, that's also a really good measurement of progress, right?
Makes sense. Um, if people want to start today, yeah, and maybe they don't want to start immediately with the entire strategy, do really the entire life cycle and think about everything. Is there like a small practical thing they can already do today to have a big impact? Um, yeah.
Um, yes, there's two things that come to mind in that space. One is, like we were saying, a lot of the things, like what we want is to reduce the stigma that exists around this. So if you are someone that has a lived experience with mental health, are you openly sharing that with other people in a way that feels comfortable for you and that you feel like you can do it with the right people in your organization? Because that already helps with reducing the stigma. When we openly share our experience and when we can have conversations around this, that makes a difference for others. And you never know when other people are going to connect with you or relate with you from that place. That's something that I am um, very open and honest with. I always talk about vulnerability with intention. And I am someone that lives with a mental health condition. So I tend to share that openly with other people because it's important for me to reduce some of the stigma, right? And that has made a huge difference. And of course, when I was in a leadership position myself, like you were saying, that also connects people with other things. So that will be the first step. Like, how are you leading by example with your experience, but also with how do you take care of yourself? I'm a person that openly talks about going to therapy, the fact that I exercise every day, the fact that I look after my well-being habits, and I share that with others also to, again, give them the permission to put that in their calendars, to do that themselves, to take care of what they need to take care of as well. So that's the one part. And I think in the other one, which is connected, is to reflect on, and I say this constantly because it is very powerful. How are you contributing or hindering the culture and environment you want to create? Are your behaviors conducive of a culture and environment where you can have open and honest conversations about health and well-being, where that is valued and appreciated? Or are you unintentionally, maybe not doing that with, negative comments around the topic, or sending emails outside of working hours, or not giving the best example about how you take care of yourself? Because all of those things also form that bigger picture, right? So first of all, start with your own example and having those conversations. And then if you want to create change within your company, I will say, are you using the resources that are available? Are you sharing your experience with that? And if you want to then create change, is connecting with the right people in your organization to think about, start with awareness. That's the first thing. Can you have a webinar? Can you have a moment of talking about this, an educational experience? Can you make resources more accessible? That was one of the first things we did as well in my previous position. There was a lot of support. It was all scattered. We created an internal portal. Here, you can find everything. And that already simplifies access for people, right?
That's cool. I really have to hold myself back to not go down that rabbit hole around the emails outside of working hours, because that's an interest. I have a different opinion, and we could discuss this for a long time. But let's go into the question, because I really like what you said around, because the first question basically, what well-being offers can be implemented without a budget that has been successful, and da da da. Already mentioned a lot of like really cool things. I mean, stigma was one. You said make resources free for everyone. Um, Feel free to add things if others come to
Yeah, and
mind.
make them
Yeah.
accessible and available and easy to find. I think that's something that, like, things already exist. Most companies have something. But do people understand what is included, how they can access it, where they can find it? I think that's something that doesn't cost you a lot of money. Having conversations, yes, it's great if you bring an expert into it. But if you cannot do that, what is the existing internal expertise around health and well-being within your company that you can share, that people can share more about with others in internal events? Leaders sharing more about their own experience. All of those things are things that can make a difference.
And then the second part of the question was, how do we prove to operations the link between well-being and productivity within your organization? Yeah. So basically, how can we really show that a change in well-being, if we are able to improve it, give people better resources, decrease the stigma, how can we show that this might help increasing productivity in the company? Yeah. I mean, there's lots of data around it and there are studies around it that we can always show, but to a very skeptic C-level is always, yeah, but it's not us. We're different.
I think it's
Um,
that once you actually, because I agree, like there's a lot of external things out there, but if you go and have conversations within people in your company, you're gonna discover that it's also inside. So that's why it's so important to look at some of the root causes internally and having those interviews with colleagues, looking at the open comments section in your employee engagement survey because people are open and they're sharing what is happening. And then you can use that data to say, hey, this is the actual lived experience of people, and this is how it can improve, and then track that over time.
Yeah, I also agree that having specific examples, qualitative feedback helps a lot because making this case like, hey, this person was going through XYZ, almost burnout, and then um, had the right resources, helped that person, and now that person is, yeah, working normal schedule again. These kind of examples make to, yeah, paint a clear picture. There's another question. It's a long one. It's around, it's basically a little bit the other kind of direction. People, what if people are under capacity, don't use sick leave or vacation due to deadlines and workload pressure? What could be useful to measure and highlight this, and especially to prevent it?
Yeah, that's a really good question. And I also think a really good metric to look at because there are a lot of companies nowadays that offer unlimited holidays, right? And then when you go and actually look at are people utilizing that, the reality is not. And it's for this, like, again, the environment, like, yes, you have it in paper as a benefit, but the environment and the culture are not conducive for people to utilize this. And you can have high levels of stress, maybe even burnout rates, and all of these things. So it does matter to look at those numbers as well. It's again, looking at what you have available, are people using it or not? And then dig deeper. If they're not, what is preventing them from using that? Because there can be a connection to that culture and environment. And then you can think about how can you change that. And the way around, how do you highlight this and prevent it? I think it's leading by example again with leadership. Are the leaders in the organization utilizing the things that are available? And that includes holidays or any other perks around their sick leave. Like, are leaders coming into work when they're sick? Are they not taking all of their holiday allowance? And then start with that conversation as well, right? Like, you need people from the top leading by example if you want other people to know that it's okay to use this or to do that within this environment, right?
We are almost on point. So we have 1 minute left. If randomly a question comes in, I don't think so.
And I want to say something because I don't like to leave people hanging. And that on the email topic, I think
Perfect.
it's important to clarify that it's more about allowing people to work in a way that works for them as long as they're open and honest communication around that. If I need to
Exactly.
send an email at an
Exactly.
hour that is not traditional, but I explain that in a way of there's no expectation for you to respond, I do this because this works better for my schedule, like then that's perfect. As long as there's always an explanation behind a certain behavior, that's what makes all the difference because you are making sure that you're not creating unintentional damage on other people by placing expectations that are not even there, right? Like the open and honest communication is key.
100%. Totally agree. I am a huge believer also in trust with all the people I work together a lot closely. Normally, when they start, we have an honest conversation. I tell them how I work. I might work sometimes in the evening. I might work sometimes even on the weekend, but I don't expect you to do this. Email, my schedule is not your schedule, and you do you. And this works, I think, is the best way to do because you might work with people in other time zones. You might work with people who, I don't know, want to pick up their children at 4 to 6 and then work again in the evening. I mean, you want to give them the flexibility. But I think in more modern, more global organization, you always will have different time schedules, but you have to really openly talk about it. 100% agree.
And I think that's the part around like mental health and well-being is it's a shared responsibility and an act of care for ourselves if we're open and honest about what we need. And we allow people to also do that in the other way, right? Because it's all about how do we show up for each other as humans and recognizing our human experience. And there's nothing more powerful than knowing that I feel seen and supported and less alone in what I'm going through. And that comes from those conversations. I used to have before this thing that it was like a one document that I call like, like Mariangel one-on-one. What do you need to know about working with me? If I will start working with someone, I will give them the document and that explains these things, right? And that will make a conversation starter around like, this is what I need. This is how I work at my best. Now tell me that for yourself. And how do we support each other? That's another really small thing that you can do, right? Like start those conversations from a place of caring for yourself and open the door for the other person to do the same.
That's a nice tip. That's a great way to end the session. Maria Angel, thank you very much. Super cool tips. I learned a lot as well. And yeah, for everyone else, I hope you have great weather almost everywhere. Enjoy the rest of the day. If you're interested in mental health support, obviously reach out to us, to Nilo. And yeah, thank you, Maria Angel.
Thanks, everyone.